You find an unresponsive elderly man in the parking lot next to his car. As the first rescuer, what is the initial action you should take? A. You must let the airway open. B. You must make sure everything is safe at the scene. C. You must activate EMS. D. You must grab an AED. What should you do if you find a patient in his hospital bed and he is breathing in agony and not responding? A. 2 rescue breaths should be given. B. You should check for a pulse. C. The patient should be placed in the recovery position. D. You should activate the emergency response system. The time it takes for healthcare providers to check for a pulse should not exceed A. 6 seconds. B. 10 seconds. C. 12 seconds. D. 20 seconds. What should be the compression rate when you start chest compressions on a 35-year-old male? A. It should be at 60 minutes. B. It should be at 90 minutes. C. It should be at 100 to 120 minutes. D. It should be as quickly as possible. Which of the following is important while performing chest compressions on adult patients? A. Enable complete chest recoil. B. Make sure the patient is lying on a firm surface. C. With each compression, push down at least 2 inches. D. All of the above. You are performing CPR on a 60-year-old female. As a lone rescuer, where is the best place for you to position yourself around the patient? A. It should be by the side of the patient. B. It should be at the feet of the patient. C. It should be across the patient. D. It should be above the head of the patient. You are performing CPR on a 60-year-old female. As a lone rescuer, where is the best place for you to position yourself around the patient? A. It should be by the side of the patient. B. It should be at the feet of the patient. C. It should be across the patient. D. It should be above the head of the patient. During a 2-person CPR, every breath you give to a patient experiencing cardiac arrest should be delivered over A. 4 seconds. B. 3 seconds. C. 2 seconds. D. 1 second. When performing CPR, how often should rescuers switch roles? A. Approximately every 10 minutes. B. Approximately every 1 minute. C. Approximately every 2 minutes. D. Approximately every 3 minutes. What should you do next after attaching the AED to a patient experiencing cardiac arrest? A. You should evaluate the rhythm. B. You should clear the victim so the rhythm can be analyzed. C. You should shock the patient. D. You should turn the AED on. What should you do if no shock is recommended when using the AED? A. Resume CPR immediately. B. Verify that the pads are correctly attached. C. Push the reanalyze button. D. Examine the pulse. For what age can adult defibrillator pads be used? A. 7 years. B. 8 years or older. C. 10 years or older. D. 12 years or older. In a 2-person adult CPR, what is the compression to breath ratio? A. 10:2. B. 20:2. C. 25:2. D. 30:2. When you perform rescue breaths on an unconscious patient who has a pulse, how often should you check for a pulse again? A. Check every 2 minutes. B. Check every 3 minutes. C. Check every 5 minutes. D. Check every 6 minutes. When performing CPR on an infant with 2 healthcare providers, what is the compression to breath ratio? A. 10:2 ratio. B. 15:2 ratio. C. 25:2 ratio. D. 30:2 ratio. When dealing with an adult who is choking, which of the following is inappropriate? A. Place both of your arms around the patient's waist while standing directly behind the adult. B. If a patient is choking and there is no visible foreign object, perform a blind finger sweep. C. Both A and B are inappropriate. D. None of the above. When performing CPR on an unconscious adult, where should you palpate for a pulse? A. Radial pulse. B. Femoral pulse. C. Brachial pulse. D. Carotid pulse. How long should it take to examine an adult's carotid pulse? A. 5 to 10 seconds. B. 15 to 20 seconds. C. For at least 30 seconds. D. For at least 60 seconds. When is the right time to put an unconscious patient in the recovery position? A. If the patient is not breathing but has a pounding pulse. B. If the patient is not breathing and has bradycardia. C. If the patient is breathing adequately and has a pulse. D. If the patient is not breathing and does not have a pulse. What should be the compression depth when you perform CPR on a 6-year-old child? A. 1/2 of the chest's depth. B. 1/3 of the chest's depth. C. 1/4 of the chest's depth. D. 1.5 inches. What should you check when you look for a child's pulse who is aged 1 year to puberty? A. Carotid or femoral artery. B. Temporal artery. C. Brachial artery. D. Ulnar artery. Basic life support certification. Imagine this: you're walking down the street and suddenly, someone collapses right in front of you. Panic sets in as you realize they are not breathing and their pulse is fading fast. In that crucial moment, knowing how to perform basic life support can mean the difference between life and death. Basic life support is a fundamental emergency medical intervention that anyone can learn, regardless of their background or experience. In the realm of emergency medical care, having a solid foundation in basic life support is akin to holding a powerful key that can potentially save lives. AHA's BLS certification not only equips individuals with essential skills like cardiopulmonary resuscitation and automated external defibrillator use but also instills confidence and preparedness in critical situations. Moreover, mastering BLS techniques goes beyond acquiring knowledge. It underscores the importance of quick thinking, clear communication, and calm under pressure.